How's it going? If you're new, welcome. If not, welcome back. Today we were talking about L5-S1 impingement as we were answering a question from Alan. Alan says he's been recently diagnosed with L5-S1 impingement and he asks what are the do's and don'ts for this sort of condition. So we're going to talk about, well, what is an L5-S1 impingement? How do you know if you have it or maybe have something that's similar to it that may not necessarily be a structural issue? And what do you do about it? What are the do's and don'ts? Which is a process of testing to figure out, well, what is your spine sensitive to? Because there are multiple different things that can cause an impingement. We'll go over a process of testing to try to figure that out. If you don't already know me, my name is Dr. Malik. I'm a physical therapist and persistent pain coach. I help people that are dealing with hip pain and lower back pain get back to a life without limitation, get back to doing the things that they love to do, all without medication, injection, surgeries, just using movement as medicine, understanding your body, and how to interpret the signals that it's giving you. And although I am a licensed physical therapist, I'm not your physical therapist. So anything in this video is purely for educational purposes only. This is not to be mistaken for medical advice. Always consult your personal healthcare provider before you make any changes to your treatment plan. Now that that's out of the way, well, what is an L5-S1 impingement? So the letters and numbers correspond to the level of the spine. L corresponds to your lumbar spine, which is the lower section of your spine. S corresponds to sacrum, which you can consider as your tailbone. So where the lumbar spine or the lower back meets the tailbone is the L5-S1 junction. And between this junction, as well as all other junctions, all the way up between all the levels of the spine, nerves pass through and they go and they innervate muscles and they're responsible for sensation, among other things. And so between the L5-S1 junction, we have an L5 nerve root. This goes down to innervate some of the muscles in your legs, as well as provide some of the sensation on the outer part of your leg down towards your foot and ankle. And that nerve has to pass through a space in the spine to get to where it needs to go. And if that space becomes crowded for a number of reasons, that can cause impingement onto the L5 nerve. This will usually be due to either a disc issue or what we call stenosis. So a disc issue, meaning those discs that sit between those segments, that disc has potentially pushed out a little bit and is now obstructing the pathway where that nerve needs to go. Or potentially through age-related changes, which are usually pretty common and normal, that space between the two segments shrinks due to disc degeneration or narrowing of the space that the nerve has to go through due to bone-related changes, which we call osteophytes. So they would need a different approach depending on which one was prevalent in your case, or potentially it may not even be a structural issue. So we'll talk about that. It's important to not chase what you find on an MRI or an X-ray because the findings like stenosis or even disc herniations often are as commonly found on people without pain as they are on people with pain, and these get more common and more prevalent the older we get. And studies show that there is not a linear correlation between pain and age. So there's not a correlation between abnormal findings on an MRI and pain. So how do you know if you have a classic L5-S1 impingement? Well, the first sign is that the pain travels and kind of shoots down your leg, usually more sharp. It goes all the way down into your foot and ankle, even into your toes. You'll often feel numbness or tingling. You may even feel a loss of sensation. So if you're touching the outside of your thighs, you may feel a decreased sensation on the affected side compared to the unaffected side, and you may feel weakness on that side that causes you to buckle or feel unstable. If it is a classic nerve impingement and structural issue, what triggers it will tend to be more consistent. So if you notice a lot of variability, like sometimes certain things trigger it, sometimes they don't, so it may not be a classic L5-S1 impingement. And also if your pain does not travel down your leg, but is maybe in glute area or thigh area, you may not have a classic L5-S1 impingement either. However, you may still have something going on in that area or that region of your body that your central nervous system is sensitive to, and that needs to be addressed. So in either case, whether it's a classic L5-S1 nerve impingement or whether it's something that mimics it, the approach in terms of what exercises you need to do is the same. You need to follow the same testing process to figure out what your body responds to. Because even if it is a classic L5-S1 nerve impingement, sometimes it's caused by disc issues. Those tend to like exercises that are different from issues related to stenosis. Disc issues tend to like extension. So perhaps if your pain is generally worse with sitting, worse with slouching, worse with bending forward, and better with walking, your body may like extension, whether it's a disc issue or not. If your your pain is generally worse when you're standing, when you're walking, when you're laying down on your stomach, maybe propped up on your elbows, or doing anything when you're in a more extended position and then feels better when you're sitting, then it may be more related to stenosis. The best way to fully understand is to systematically test and see which type of exercises your body resonates with. So there's a 3-step process that you need to follow. First step in that process is to set your baseline. You want to pick something that's relevant to you and your condition. It could be something as simple as just standing and bending forward. It could be standing up from a chair. It could be turning over in bed. It could be going up the stairs. Something that's functionally relevant to you that you do on a regular basis that you can also feel some of your symptoms with, so you can monitor it and you can set a baseline. So you'll start by doing that activity, setting your baseline on a 0 to 10 or 0 to 100 score, also noting kind of how the quality of movement feels or how much movement you have. And the second step is to implement an exercise. You can simply start by doing spine extension, which theoretically would usually be better if that L5-S1 nerve impingement is due to a disc issue, or if your body is just sensitive to being flexed and it's not necessarily a structural issue. So you'll start by doing 10 reps of this, going as far into the motion as you can, holding about 2 to 3 seconds at the top. Of course, don't push this or any exercise if it's sharp, it's getting more uncomfortable with more reps. Only do it if it's tolerable and ideally gets easier to do with more reps. So monitor what you feel during. However, we can't fully make decisions based off of what you feel during. Sometimes an exercise may feel like it's helpful, but maybe it feels good for the muscle, but it's irritating the joint, and you won't know that until you do your baseline testing. Maybe an exercise doesn't feel like it's doing anything, but it could be exactly what you need. So you always have to test your before and after in terms of your movement. How does your movement feel? Is your movement feeling better? Do you have more pain-free range of motion? How are your symptoms with movement? Is super important. So let's say you test 10 reps of that exercise, and then you would go and do your same baseline test again. So in this case, let's say that bend forward was your baseline. You'll go and you'll recheck that. You'll see if it feels better, worse, or about the same. And then you can use that to make decisions accordingly. If it feels clearly better, then your body may need more extension-based movements and positions. Simply doing this exercise on a more regular basis and avoiding positions where your lower back is slouched or rounded, or avoid prolonged periods of being bent over. If that exercise does not feel like it helps, you can try variations of it that target the affected side more, like bringing your leg up into a more flexed position and pushing up that way. And if extension in general just doesn't feel productive, then you can try a flexion-based exercise, which would in theory help open up the space and reduce the impingement that way. In this case, same thing. You'd be doing 10 repetitions, 2 to 3 second holds, and monitoring your symptoms during, then testing your baselines again after and checking for response. And then if this, for example, made your baseline better, then that means your body needs more flexion-based exercises and positions, and temporarily may need to avoid more extended positions, like being on your stomach, maybe propped up on your elbows, or maybe bending back to reach up to get something or tinker with something. And of course, this is not an all-inclusive list. Your body may need a different type of exercise. Your spine may have a preference to more lateral movements that may alleviate symptoms, or more of a rotational movement that alleviates symptoms. But beginning with flexion and extension is a really good place to start, and you'll get a lot of information out of that. You can use that information to determine kind of what activities you may need to temporarily modify or avoid based on what your body is sensitive to and what's kind of potentially producing the pain that you feel. And of course, there are a lot of nuances to this. I would start with 10 just because it's simple, easy, but sometimes it takes more than 10 reps. Sometimes the hold, instead of being 2 to 3 seconds, needs to be sustained for a longer period. Sometimes you really need to focus on really getting into that motion as far as you can. So start with this, see if your body has a preference to either flex or extend. If it does, wonderful. Whatever your body has a preference to, begin to do that exercise more often during the day. Then use that principle of motion that it likes, and then try to avoid the opposite. And if that is the routine for you, you should notice that your symptoms are better and progressively improving. And as your symptoms improve, you would then progress into more exercises that reinforce your body's sense of stability, building resilience in the body, and from there, progress into reintroducing those sort of movements and positions that were previously uncomfortable or previously pain triggers, to work those back in and make sure that your body is no longer sensitive to them. And that's how you know you've recovered. So that's all I got for you today. Hope this helps. Try quickly testing flexion and extension if that's the case for you. Let me know in the comments or anywhere you can reach me. If you feel stuck, let me know and I'll try to give you some more ideas.